Hello, this is Dr. Jamie Skipper from Elevation Health Consulting here at the Digital Health Studio at CES 2020. I'm here with Dr. Ron Park, Vice President of Global Product Strategy for Personalized Healthcare at Genentech. Welcome. Welcome,
Thanks
Dr.
so
Park.
much. Glad to be here.
It's wonderful to have you here. It's really exciting to have Genentech here. Now, is this is this the first time that Genentech is coming to CES?
Yeah, actually, this is the first time I've certainly been here. I think we've had some people that have come to attend, but really this is the first time we've come to be part of the dialogue, to be on stage and having discussions in panels.
That's awesome. So tell me a little bit about, as a force in the drug pharma world, what are your thoughts in terms of entering into the CES space?
Yeah, no, I think this is very exciting for us. Obviously, we've been a pharmaceutical company that's been around for 150 years. I think we've been very successful at that. Over the last 20 years or so, we've been really a leader in developing personalized medicines. So we were one of the first companies to launch a targeted medicine at specific mutations in cancers. But I think what we really see over the last 5 to 10 years is the explosion of healthcare data, along with all the technologies that can generate that, whether that be genomics, whether that be digital health tools, electronic medical records. And our belief is that that explosion of data and the analytics and technologies that are associated with that really have the potential to greatly enhance our ability to discover and develop and then bring medicines and therapies to patients.
That's exciting. So I really want to hang on what you said in terms of data. So talking about all the data that's coming out of all the products that you're seeing on the floor here, even yesterday and today and this week at CES, what are your hopes in terms of working with companies that are here displaying at CES? What are the data feeds and the data partnerships that you want to see happen with Genentech coming in the future?
Yeah, I really think that the types of data that we're interested in interacting with companies on really span the full spectrum of patients, right? Whether that be data that's generated in the hospital, whether that's data that is generated through digital health tools, especially outside of the clinic, outside of the hospital, right? I mean, this is the kind of data that, as a company devoted to discovering new medicines, we've never really had strong access to that. But we know that a lot of what happens outside of the healthcare setting, that has a tremendous bearing on the effectiveness of therapies for patients. And so to really have to work with companies that are at CES, to be able to work with them to collectively mine that data and understand how to make therapies better for patients, that's very exciting for us.
That's great. That's just exciting to hear that you're looking for those kind of partnerships and trying to really change the patient story and patient outcomes. And talking about patient outcomes, which is my bailiwick, I have to ask you, when we think about patients and data to change their outcomes and to improve it, you can't not talk about value-based care.
Of course.
So what, in terms of Genentech as a company, as a doctor yourself, when we say the words value-based care in this realm of CES, what does that mean for you?
Yeah, I've as a physician, I've long been a proponent of this concept.
Absolutely.
I remember even 10 years ago when we had a discussion with a major payer in the US about trying to create an outcomes-based reimbursement approach to medicines. And they said, we don't have access to the data, right? And it would take us too much time and effort to build the systems to track this, right? Now here we are 10 years later, and this is really routine. The data sets exist, they're collected on a routine basis, they're much more multimodal than they've ever existed in the past, right? So I really think we're in an era now where value-based healthcare and a really sophisticated view of that is now possible.
Yeah.
And I think we're seeing more and more such agreements happening.
That's great.
So I think you can already see the trend going, but we're really quite a proponent of saying, let's really figure this out together between providers and payers and the pharma industry, because at the end of the day, that's really the right way it should operate.
Absolutely.
Which is the right medicine going to the right patient and having an effect.
Right time. Mm-hmm.
That should be reimbursed, and if not, then we should be thinking about other ways to handle the situation. But this should be about having the maximum impact for patients.
Absolutely. Well, as we wrap this up, what is the one message that you would like to tell the CS community in your last few seconds?
Last message I would say is we are obviously in the midst of a healthcare data revolution,
Absolutely.
the same way that it's changed other industries. I'm really encouraged by what I see here today. I think we're really hitting an inflection point, and I'm really excited that we should all be working together to make this happen as quickly as possible because patients are waiting.
That's an amazing, perfect message to end on. Thank you for joining me here on stage, Dr. Park.
Thank you.
And this is Dr. Jamie Skipper from the Digital Health Studio CES 2020.